Hi, Donna. Thank you for hanging out with me today. I know we've got very in-depth topic to talk about,
That
but
is
I'm
true.
glad that we're here to talk about it because I think it's really important. So, I'll give you some time to tell everybody who you are and what got you into advocacy.
Sure. First of all, I just want to say thank you to you and for G-PACT for even having me on. It's been really exciting for me as someone who's deals with GI issues and has worked with a population that deals with GI issues to see all the
Hmm.
great work that GPAC is doing.
Thank
So
you.
just know that, we're grateful for your work and I'm grateful for this opportunity to come on, talk about my advocacy and talk about the film. So my name is Donna Sullivan. I am the mom of three medically complex kids who live with Ehlers-Danlos syndrome and the whole long alphabet list of everything that goes along with that. My children are a little bit older, so unfortunately, I was in the trenches of our medical system, about 14, 15 years ago when awareness of connective tissue disease and all the comorbids associated with EDS was a lot lower. I was really fortunate. My kids fell into some really deep, dark places in medicine in some of our top pediatric hospitals, and we had some very serious harm that was unintentionally done. Never, it was always well meaning physicians who just didn't understand what was in front of them. But
Yeah.
we had a really traumatic medical journey with very serious suffering and, a lot of surgeries. My son had complex regional pain syndrome. It's just, we really kind of went to the mat. And I was lucky because I had met a group of moms back in, I guess it was 2011, who had formed a nonprofit called the Coalition Against Pediatric Pain. And they really were just a group of moms whose kids, like mine, were not getting better. We were
Yeah.
in the hospitals, we were in the pain programs. Our kids weren't responding the way that they thought. And we all kind of experienced this weird feeling that we were almost being blamed, like, "What is wrong? There's clearly something wrong with you or it's your kids," and, the kids were being diagnosed with these psychological diagnoses. Mine weren't, but many others were, and I learned a lot about mind body medicine and the differences between organic, issues versus functional issues, and it just was a really dark, confusing place, and our moms group really brought me sanity because I think, finding people who live with your condition who are also kind of outsiders in medicine, is the way that a lot of people with a lot of conditions, find their way, find their
Hmm.
footing through support groups.
Yep.
So our support group grew very quickly because back then there was nothing for kids with pediatric pain. Nobody was really even talking about children with having pain.
Hmm.
So we very quickly became overwhelmed with families finding us, and it was very often very similar stories, the same constellation of problems, having trouble finding doctors that could help, the children suffering, trauma because they
Yeah.
couldn't get help. And over time, unfortunately, the problems that were finding us were getting bigger and bigger. So my advocacy got a little bit louder. I come from a, a long line of Italian women who
So it got
tell
a
it like
lot
it is.
louder. Who
Yeah,
are you
they
kidding?
tell it they tell it like it is. So, started doing some writing and just kind of raising our voices, with other moms and other organizations that were having the same experience. And we knew early on, they talk about real world evidence, all these kids had the same things going on and medicine wasn't even acknowledging, that connective tissues everywhere in the body and that all these kids with GI issues and with, POTS and dysautonomia and all these other
Yeah.
things, it really was connected. So that's kind of how I started. I started out kind of as a parent who was kind of stuck in the medical system and I plugged in with a nonprofit that helped me become an advocate, through
Yeah.
writing and support.
Feel like everybody has some sort of similar story. Like all of us that dive into the deep end of advocacy, it's all because we wanted to do something about the pain that was inflicted upon us, whether it was intentional or unintentional. You go through something and you're like, I didn't like this. I can't be the only one. And then that opens up your world to all these other people that you're like, wait, you're just like me? Wait, they're just like me? I thought I was the only one. I thought I was weird. I didn't know that happened to you too. And then all of a sudden, it's like all these things start to click together. And then you end up like in a position where you are, where I am, where we're like, this is just something that it it's so deeply ingrained in you that you want to do something about it. So you just can't not do something about it. And that for you seems to roll us right into the big part of this topic and talking today is how you got involved with the film Complicated and, besides just the advocacy in your own experience, but how that came to be and how you got involved in that. Because I've now seen it, I'll say 1.5 times, because as I said, the second time I didn't watch everything through completely,
Yep. It's not an easy
because it
watch.
was very, very emotional for me with just my personal experience and my personal, connection to the film as well. It's a tough one. So that's yeah.
Yes, it's a very tough it is, it's a very tough watch, and that's something that when we present it, I try to kinda warn people, this is going to trigger you. You are going to probably see yourself in this film,
Yes.
unfortunately,
Yes.
and it's something that the director, Andrew Abrahams and I, discussed, should we put a trigger warning at the beginning? It's a general audience documentary, but, I am aware that this is not an easy film to watch, and that was never our intention, so
Yeah.
let me just kind of back it up a little bit. So I was working as an advocate with this moms group, and we started getting more and more families coming to us that not only were unable to get care or were being harmed in our top pediatric institutions, but we started seeing more and more families having this other problem where the moms were actually being psychologically diagnosed with Munchausen. And when I say diagnosed, it wasn't like they saw a psychiatrist and they were, somebody followed a
They
DSM
were armchair
criteria.
diagnosed.
Yeah, it
Yeah.
was like some, resident in the ER put it in a file and suddenly it became fact.
Yeah.
So we started getting more and more of these families. And one day we had a summer camp and this mother was being investigated. We were talking to her and, we kind of looked at each other and said, what other moms in the room? How many other people have been investigated? And I swear to God, it was like almost 70% of the room had their hands up. And we're like, how could this be?
My gosh.
So, yeah, it was a very sobering kind of moment, and it's a dark moment because, you feel all the emotion that people that feel like outsiders in the system feel, right? You feel vulnerable, you feel fear, and we're like, "Oh my gosh, like, what do we do about this?" So, unfortunately, as more families rolled in, we became good at understanding why these cases were happening and started to reach out to attorneys and researchers and medical experts and other organizations. How do we help these families? Because nobody's helping these families. But we had one case in particular that we were helping, that I was helping that became their story became very widely known. It was a mother by the name of Beata Kowalski. She had a daughter, Maya, who had the same condition my son had. We were able at the time to pay for money to go to New York for ketamine. They took their daughter out of the country. And when they returned, the hospitalists, felt that mom was over medicalizing her daughter. They took her into custody in the hospital. And what happens is when the hospitals take custody of these children, they wanna show that they've been over-medicalized, so they demedicalize them. So they strip away medication and, I should say it's not done with ill intent, they really are trying to get to the bottom, but the kids suffer greatly.
Yep.
And in this case, the mom, in a very horrible moment, decided if she was the reason, they kept telling her she had Munchausen, and as soon as you're accused, there's no way back. Like, it is everybody looks at you different, you lose your credibility, you lose access to medical decision making. So mom hung
Yeah.
herself and I was inpatient with my son at Cincinnati Children's Hospital at the time, and I got the call that Beata had died. And so I cried for 3 days, and then I sat down and I called my mom's group and I'm like, "We gotta do something. We have to stop this." So I had a background in media. I was a journalist,
Hmm.
and worked in marketing, so I wrote a film treatment, and we started looking to find someone who could help us tell this story, and got really lucky, because we had talked to a few directors, but we've had this one found this one director, Andrew Abrahams, who had done this film called Under Our Skin, and it was all about chronic Lyme disease, and what happens to patients when they can't get care, and what happens when there's medical controversy. And the medical controversy part is always really interesting because when doctors disagree, there's all kinds of things that go on with the institutions that really impact the kind of care you can get. And he understood that. So we pitched him. And at first, I think he kind of looked it over because, and he kind of called and said, wow, like,
That's a
I
lot.
rarely yeah, that's a lot, and I rarely have people give me a whole documentary because, like, we already knew who we wanted to, talk to and what doctors we wanted to bring in, and
Mhm.
so he agreed, he took us on, and we were very grateful, but then we had to raise money, and that was really hard because nobody believed this was a problem, and so that's part of the reason the film took us, it's now been 9 years to get this film done, but it's done, and it's coming out in March on Apple TV, and I'm sure that was a very long answer to how the film came to be, but now you know the whole story.
Well, it's so interesting. Like it's a weird full circle moment for me to have this conversation now because as I had mentioned, I am a personal connection to the story because a friend of mine is one of the patients featured in the film. And I remember way back when, like we were just talking, like I can't believe it's been that long since, these moments have happened when they feel like they were just a couple days ago. And it's no, years have passed and talking about this film. And I'm like, what is that? Like, why even a film? That's so weird. Like, because you're younger and you're like, what is this? Like, why would anybody want to talk about this? What are they coming to your house for? Like, at the
Eh,
time, it was weird. And I'm like, oh, okay. And then when I learned what it was about back then, I was like, because I had already been, I had already had collected 4 to 5 chronic illnesses at that point. So, I wasn't a stranger to what was going on in different medical systems and having rare diseases and some of the issues that are mentioned in the film too. And it just was like, oh. And then as she got sicker and more things happened, and watching it for me was so interesting because I'm seeing something that I kind of like parasocially, I guess is a way to put it, like
mhm, yep,
experienced in real time. Seeing some of the things in real time that are talked about in the film and remembering how I felt when someone that I cared about was going through all of these things. And it brought up some of that emotion and the anger that I remember feeling back then. Like, how could they do this to her? Like, I don't understand. This feels illegal. This shouldn't be a
right,
thing. And then all of a
right.
sudden, I'm like, holy shit, this is actually a thing. Like, this happened. And then you see there's more people that are involved in the story and more things happening. And I'm just like, whoa, wait a gosh darn minute. Like,
Yeah, yeah,
I am so, so, so emotionally like triggered, as you said
yeah,
earlier,
yeah, no,
by this.
100%.
And it's so many different feelings at once because you feel anger, you feel grief, you feel sadness, you feel connection, you feel like somebody sees you for the first time because you're seeing some of what you feel day to day mirrored right in front of you, your own experiences. You feel validated in that this happened to me too. And it's a weird, there's like all these things going back and forth. Like none of them are happy.
Right,
Right?
no, I
Like,
know. They're
but
not,
there's
they're
all these
not.
conflicting things happening. And I'm just like, I don't know what to think about this right
I don't know
now.
what to do with
But
this,
it's
right, it's a lot.
so powerful. And one of the things that really, really touched me and that stuck with me, those things that like, it's like epiphanies, they just kind of like stick with you. And there was one of, the patients was talking about that demedicalization that you were mentioning and going through that and blaming a lot of her issues on psychological issues, not believing her, and said something along the lines of, I did not go in there with like a mental disorder, but I sure as hell came out with one. And I'm like, chills. That right there has stuck with me. Like when I watched it again before we were going to talk and just to make sure that I had like my thoughts all together, I'm like, no, this made my thoughts jumble even more because it just
Yeah.
gave you all those emotions again. But it's unbelievable when knowing where I was back when this was starting and thinking like, that's kind of weird, right? Like, why would anyone do that? Experiencing so much of that, realizing what actually can and does happen in some situations to like, everybody needs to watch this. I don't care if you don't know what EDS is. I don't care if you don't know what a chronic condition is. You can be the healthiest human in the world, have all the privileges in the world, think this could never happen to me. You need to sit down and watch it because it
100%.
could happen to you. It could happen to your best friend. It could happen to your sister, your brother, your mother, your cousins, your neighbors 3 houses down. Like this is so, so powerful and it doesn't escape anybody, right? Like it just because you have something now or don't have something doesn't mean that this isn't a situation that you may get attached to at one point or
Yeah,
another. And it's
absolutely, and
terrifying.
well,
It's
and there's so
terrifying.
many yeah, and I have to tell you, like, we cut this film a million different ways, right? There's so
Yeah.
many pieces to the chronic illness, kind of what I call medical misfit journey, right? We're not fitting into a neat box. There's no test. There's
Yep.
no, especially with kids, you have, like, I hear it all the time, if it was cancer, my daughter got diagnosed type 1 diabetic. She goes, Mom, this is so easy. They know what it is and they know how to fix it. But for people
Yep.
that don't have that, the diagnostic journey, 8 to 10 years on average, the number of misdiagnoses, all the trauma that comes with it, people don't talk about it. And they don't talk
Yeah.
about how a lot of these well meaning psych programs actually create harm. And let's talk about the harm that's inadvertently happened to patients. So, just to back this up for a second, I want to thank you so much because I was really excited to talk to you because you are a stakeholder, not only because you live this, but because you walked beside Morgan in our film when she was going through what she was going through. And one of the more interesting parts of this, as we all know, is social media.
Mhm.
And I always say, if you don't live this life, you probably cannot imagine what it's really like. And it's like anything in life, right? My grandmother used to say, walk a mile in their shoes. These shoes have a lot of deep, dark problems that other conditions do not deal with. Caregiving for children with these conditions is very different because it's unsupported problems that these
Mhm.
caregivers deal with. And nobody's talking about that. So someone like you, you saw all the judgment, all the meanness, all the bullying
It's
that
horrible.
Morgan endured
Horrible.
online because all these people are sitting back quietly making judgments, not really seeing what she's living day to day and what she's going through. So, you knew her, you live it and you witnessed kind of all the judgment. And I think that's one of the biggest things that I am hoping more than anything this film accomplishes. That people can see the human beings behind this and kind of what is happening to them without bias, without judgment, without,
Yeah.
all these bogus narratives.
Yeah.
Um,
It was
and I knew
horrible.
when I sent you the film that it was gonna break you. I did. And I
It
felt
did.
and I feel terrible. I feel like I'm always apologizing, right? I'm really sorry. I don't mean but that's why this film is so
Important.
important. And
Yes.
this is
Yep.
why we are getting calls from around the world to get access to it because this is an unspoken epidemic in medicine and
Yeah.
it really needs to come out.
Yeah, and I was talking to my husband about it afterwards and talking about, like, where my relationship with Morgan was at the time and, watching that from afar and, even just being able to meet somebody, right? Like, we didn't, our I think we were maybe like 3, 4-ish hours apart from each other, but it was like we were able to actually meet in person, and it was one of those moments where you are talking to this person for so long, and then all of a sudden it's like, "Hey, we actually could, like, meet each other and see each other for the first time." But, to really sit there and be like, "I can make a physical connection with this person too." And it was like it solidified our relationship at the time. And then, stay in contact. We shared similar conditions. We shared similar doctors and specialists, right? So, it was she was one of the closest people I had at the time. And then to see, I don't wanna call it a downfall because but I don't know what other word to use in there, but watching, all of a sudden, I'm like, "This isn't the person that I knew this isn't the same person. And, her heart of, I just want to share my life online, not because it was like, oh, poor me, I want attention, look at me. It was, hey, I'm really isolated. I'm going through some stuff. Maybe what I could share could help somebody else. That was always the intention.
That was
And
always her intention.
whatever corner of the internet her name got dropped into was one of the most horrific things I experienced, and it wasn't even happening to me. And, that's an entire, like, 4-hour-long conversation on its
Yeah,
own to go down that.
100%.
But that made it kinda goes into the narrative of, like, it's so easy to disbelieve these people or pass it off as psychological. Well, there's also the chance that maybe the effects of the physical disease do have some manifestations of psychological disease or, depressive disorders, anxiety disorders, or anything else that falls under that umbrella, but it doesn't remove the physical disorders and the physical problems in itself. And I'm like, why can't we just be both? Like, why are we trying to force people in one camp or the other? Like, if you have chronic conditions and you're going through something, you probably are going to deal with some level of, anxiety, depression, or some sort of, mental disorders on top of that. I know I do, but it doesn't change anything. So I'm like, why do we have to fit in one camp or the other? And why can't we just treat us like as human beings?
Well, and you're hitting the nail on the head. Like, I can't tell you how many doctor's appointments I would sit in that'd say, "Well, he's got this physical issue, he needs psych." And it's like, mind body's connected. It always needs to be connected. So why do we disconnect it when it comes to
Right.
people, right? I
Right?
never have understood that. And now, we know, right? Unfortunately, the gap between research and clinical care, right? We
Hmm.
know that things like POTS and autonomic nervous dysfunction is your nervous system. So you
Yeah.
can have what looks like a panic attack and it could really be autonomic dysfunction. Well, let's look at the medical causes. But in psych, psych in itself is a whole field that has so much work to do,
Yeah. Our whole
so much
medical
work.
system.
Yeah, the whole medical system's broken. Let's be honest. It is broken. And,
Yeah.
we have to just start chipping away at what's what. But, I have to tell you, when we were, so for people who haven't seen the film, we should probably back up and just say Morgan is this amazing young woman who struggled with what they thought was functional GI, because they always start there, right? But turned out to be organic Ehlers-Danlos and gastroparesis and all kinds of very complicated comorbidities that come
Hmm.
with, but unfortunately, I look at Morgan as like a pioneer. This happened to
Yeah.
her, when my kids were sick, when nobody knew anything. And she paid that price of pioneering, because she couldn't get the care. And unfortunately, we see and we watched, Morgan go from being this unbelievably strong, vibrant advocate, just wanting to help people, to someone who started to have other symptoms that can come with neuroinflammation, that can come with viruses and immune system dysregulation, and can become very serious psychiatric illness. And unfortunately, that's what happened to her. But because she was over the age of 18, and this is another
Yeah.
problem in our healthcare system, right? She's an adult and can make her own decisions. So accessing care became really difficult when you have one foot in the medical world and one foot in the psych world, and the two don't work together. And I've had this with my
Yeah.
own family where, like, you would like to get some psych support, but you have to go into a med psych program because you have medical issues. But then you get in there and they don't really treat the psych the same way. And it's just, we need to find a way to bring it all together. So unfortunately, really unfortunately, watching Morgan's journey is very distressing and very concerning and
Yeah.
is something that, you hope we don't scare people, but we also wanna show the world, how this is happening to people. I have so much respect, for all that Morgan endured, especially online. We actually did
Mhm.
research. We went into the cesspool of the internet, we went down to Reddit,
Oof.
and I was
Oof.
horrified to find, we found communities of physicians trash talking
Mhm.
patients. I mean, we
Yep.
found patients trash talking. Like, there's so much of that toxic, out there. And Morgan absorbed it all because she was a sick kid home with,
Nothing
isolated
el
and
it was like we had nothing else to do, so we have the internet because that's our door to the outside world, out to connection because you are immunocompromised or you're in pain and you can't do something, so you go online, and once you see one thing that rabbit hole is so hard not to go down. Like, I remember the first time I started, like, searching for myself online to see, like, if anybody was saying anything, and I was like, "No, don't even do it. Don't even do it. It's not worth it." I have no clue.
Right.
The only places
Yeah.
where I know my name is attached is, like, to G-PACT and, like, my LinkedIn page and,
Yeah.
like, to my cat
Yeah.
photos. But
Well,
I'm like, if there's
because it's
anything else, I don't
scary.
wanna know because
Yeah, because
it's
it's very scary, and I think it's even more scary now with AI. I don't even know where the world's going, but I just know that, Morgan is a prime example of somebody who, because of her inability to get care in a timely manner, paid a
Yeah,
very physical price, and
yeah.
I'm just so grateful because, like, let's be honest, people would be surprised to learn this. We only followed 6 families, and 5 of them are in the film. And the stories we captured are outrageous. So, like, imagine if we had done 20 families and what we could have pulled, you know what I mean?
Couldn't have watched that one. Like
No, I well, exactly, like, I mean, it's kinda crazy when you look at the outcomes, the unexpected outcomes, we didn't anticipate any of this. We wanted to make a film, basically to give these young people a voice, to show these kids that were being psychologically labeled, unable to get care. We wanted to show that they were strong, they were brave, they were fighting, and they weren't what medicine was making them look like and feel
Yeah,
like.
yeah.
That was the intention.
And that comes
Unfortunately.
off. As much as I'm like, I was triggered, that comes off. And seeing what they went through and seeing some of the patients afterwards saying, like, I know that you didn't mean to hurt me. Like, I'm still here. I'm still doing like, with a freaking smile on their face to the best of their ability to say, we're here, we're just trying to live our life and we just want to exist as human beings. Like, whatever, like, however their parents raised them to give them that amount of, like, humbleness and humility and honestly, forgiveness, like, I don't know that I could do that given what I know that they went through, and we only saw a fraction of it.
I was gonna say it, and you're referring to Kira in our film, and she's a child who unfortunately, geography plays a role in the ability to
Mhm.
get care, and she lived in a state that had horrific awareness, a
Yeah.
lot of medical arrogance, because that's always a problem, and she went through some really horrible things, because she was taken by child protection and her family was harassed, and it interfered with her medical care, and it ultimately cost her everything. So, I cannot, I mean, I carry these kids with me every day, they're my kids, but, like, I feel like the the gratitude I have to these kids and these parents for being brave enough to let us film, to
Yeah.
be willing to let us into their darkest moments. I mean, we had a couple scenes in the film where I was like, "There's no way we're gonna film this," and then they're like, "No, I wanna talk about it." I'm like, "Okay." And I'm proud of them and I'm grateful, but, that took a lot of bravery, and, one of the things when we did
Absolutely.
this film, we stayed stealth, like, we didn't want anyone knowing this film was happening. Basically because there's backlash. What do you mean you're gonna call out, a top pediatric institution that, never does wrong?
Yeah.
Um, you think you're gonna get appointments for your kids again? Good luck, right? But, what I learned actually through my advocacy in making the film is there's battle zones in every hospital.
Yeah.
The stories I get from physicians, we have physicians that have these conditions that don't tell their colleagues they have these conditions because they
Uh-huh.
know there's so much bias against these
That's cr
conditions, and
that's mind-boggling, actually. I think that to me right now is the most mind-boggling thing that we've said right
yeah,
now.
there's so much. It's such the upside down. But it's true, and, I sat with that because 'cause I'm like, "Well, why? How?" Like, I live in a world where you go to the doctor, they're great, they help you when you leave, and, I realize it has to do with uncertainty. Like, healthcare, medicine does not allow uncertainty. Think about it, medical students, they can't be wrong. They have to be right or they're not gonna become doctors, and,
Yeah.
again, I always say this is all a no-fault problem. This is a systemic issue. This is not anyone being nefarious. It's not doctors are bad. The film is actually pro-physician,
Mhm.
because there's so many physicians that I work with in my advocacy and medical education work that are like, we need to refer our patients to people and nobody's taking them.
Yeah.
So, we wanna support these physicians as well. And I'm sorry, I didn't mean to take us so far away from your question talking about the film, but, to kinda sum
It's
it all
all
up, like,
important.
yeah, I'm just so proud of all the kids in the film, and grateful, and I feel like there's definitely a heaviness of carrying their stories forward, to help others. But I know, like, when we show this film at screenings, half the theater sometimes is in tears, and the people that come up to me and honor me by telling me their story, um, it just makes me more determined to get this film out and to try to get, we're trying to get funding now for the education. Like, we have to educate these institutions on how to stop the harm.
Yeah. And it's interesting, like, I got sick after I was officially an adult, right? So, I didn't go through this as a child. I was a relatively healthy child. I don't know if my mom would agree or disagree with that, but we'll go with it. Um, and I'm like, I know that I was still a baby. Like, I don't care if I was legally an adult and you were treating me as one, I was still a child. I did not know how to do anything. And, very early on I got sick in right out of college. So I was like 22, 23 years old. I was still a child. I didn't know anything. I
Mhm.
didn't know how to pay bills. I didn't know any of that stuff. Right. So
Right,
why should I make decisions on my healthcare? I absolutely should not. I should have a say, but like, I'm still a kid. And the
right.
more that things happened, the more they got complicated, the more rare diseases I piled in. And I know that my mom and I have had conversations like back then, and we've even talked about it like now, where we were afraid to say something because we didn't want it to be that, like, wouldn't get care, or you get the reputation that, oh, they're non-compliant, or the mother is difficult, and she always brings her mother, right? Because she's a sick kid, and you can't talk to them and anything else. So there were times where both of us stayed quiet because we were afraid that I wouldn't get care if we talked too much. And then there were
100%.
other appointments. I had a rheumatologist when I was trying to find somebody that would take me as complicated as I am. And this was before I was as complicated as I am now, to take someone. And my mom and I were just asking questions like, well, if you don't think it's this, what would this be? And okay, so what would you recommend? Like, we were asking her for answers and asking her for next steps. And she fired me as a patient because of that. And she was
Eh,
saying to my mom, like, about being assertive or aggressive. Truly, I don't remember which word she used, but my mom's like, "I what?" And I'm sitting here
right.
like, what twilight zone am I in right now? Like, what is happening here? And we never went back because I got fired as a patient. And initially, I liked that doctor. And it was like other situations in the hospital, like, I have hypoparathyroidism. Most doctors read that as one sentence in a book and they're on their way. They don't know anything about it. You add the GI issues of not absorbing anything and have to tell them, hey, I require IV calcium. I've required IV calcium for over a decade. No, we have to do some testing first.
Right. So
But if
so
if you
why?
start
Like, why don't
talking,
they believe you?
but the more that we sit there and we're like, well, no, here's a picture of the prescription. Here's the doctor's phone number. They're in your medical system. Please go check my records. Then they don't check the records. And then I sit there, and next thing you know, it's like you're in tetany, I'm having laryngeal spasms, I'm having seizures, I'm completely in lock. I can't speak, I can't breathe, I can't do anything. And my mom is running out in the hallway like, we need help in here. And after she's trying to pry my jaw open to pour meds down my throat because there's nothing I can do. I'm completely incapacitated in this moment. And once everything calmed down, I'll never forget it. The PA or whoever was on the medical team comes in, and my mom's like, "Did you know that this could happen?" And they're like, "Well, yeah." And she's like, "Then why did you let it happen?"
For I hate that you went through that, right?
And that's
And that's
mild.
and that's but that's also dramatic, right? Like, think of how
Yeah.
scary that is for you. Think of how preventable that is for you. And what you are talking about is something that is massively common and should never be. Like, patients like us, we're no longer patients. We feel like a problem,
Uh-huh.
right? We know going in that we are coming in hot. And we know that if we don't behave a certain way, they're not gonna wanna deal with us. And I can't tell you how many times physicians fire people. We One of my favorite stories, my daughter was seeing, a physician, and he basically said to her at one of the appointments, because we had to make a few appointments, he goes, "You know, I I'm not gonna see you anymore because 'cause you're not following my standard, um, what did he say? My standard path of, improvement or something. And she just had surgery. And I looked at him and I said, "Well, she has
It's
Ehlers-Danlos, right? She has these conditions. It's going
yeah,
to take her longer. She
yeah.
will get there, but that's part of her condition." And he looks at me and he goes, "Well, that's why none of my colleagues wanna take Ehlers-Danlos patients." And I was like, "Oh, there it is. Okay, great. Thank you for your time." And, in those situations, you have to realize you're either gonna have doctors who I know, right? And I thought in my head, "Well, that's convenient. You only take care of patients who get better."
Oh, yeah.
How convenient for you. You must be a great doctor. But that really happened, and now as a mother, I have to hold my 16-year-old and say he's not
Yeah,
rejecting you.
yeah.
He's an idiot basically,
This
or
is
he's
a perfect
arrogant, or he's
moment of it's not you, it's them. You
right,
know?
100%. But they don't, but you still feel it.
Yeah.
She was fired by a doctor. And,
Especially at
as a
that such a young age, that's so
oh,
impressionable, like, "This is my fault, like, it's my fault I'm sick, it's my fault that I can't get better, it's my" like,
right. Right, that you had this horrifically stressful, horrible attack
'cause
that
that's
was
good for healing.
preventable. Right, because that's great for healing. And, I have a friend who's a physician and her daughter is very sick and she has to go in for these monthly treatments. And mom is like, here is the protocol that always works and she doesn't get traumatized by. And
Mhm.
I cannot tell you how many times she'll call me and go, they didn't follow it. All hell broke loose. And I'm like, why aren't they listening to the patient? And I don't know when patients became considered non-credible, reliable sources of what's going on in their own
Yeah,
body. But the fact is, that's where we are. And part
yeah,
of that is the narrative piece. Like I said, people that have certain conditions, they look at as malingering. I had a doctor say, oh, they're all over dramatic. They're this or that. And it's
yeah.
like, well, no, they're frustrated. They're suffering. They're
Mhm.
not getting care. And, that's why, like Karen said, I didn't have this before I went in, but I have it now. It's a two-sided street, and that's why I think the advocacy has to be focused on both sides, supporting the physicians, supporting the
Absolutely.
patients, and figure out how to work together. But it's a mess. And,
Yeah.
your story, infuriates me and makes me so sad and makes me, I will share, I don't usually do this, but I'll share a quick Karen story. Um, she was in hospice and
Mhm.
she had to go get a procedure. Her central line came out. So I was her proxy. I went with her to the hospital and I watched this busy ER doctor come in and he's trying to place the central line. And she's told him multiple times what she's allergic to. I told him what she's allergic to and she can't turn her neck because she's fused and he's getting frustrated and she's apologizing to him. And I'm
Uh,
sitting in the room thinking, why are you apologizing? He's being a dick, right? I'm sorry for my language, but he's not treating you respectfully. He's
yeah.
not treating you respectfully. Well, long story short, he finally gets the line in. He says to her, it's probably not going to last very long. You're going to have to get it done again. I wish you luck. Because he just needed to get to the next patient. And, and
Thanks.
it was and it wasn't his fault. He was one doctor covering an ER. So you know what I
Yeah.
mean? In spite of this, I still felt for him because he was the only doctor and shame on the institution. But long story
Mhm.
short, she gets into the ambulance, they bring her back to hospice, and she goes anaphylactic because he didn't listen and he put the betamethasone, the pad on
Mhm.
her. And so now this child's suffering anaphylaxis. So now it's chaos at the hospice. Now it's a problem with the hospital. And Karen's apologizing to
Been there.
everybody.
Been there.
Yeah, and it's just
Yep.
not right. It's
Yep.
it's not it's not do no harm,
Yeah. Yeah.
So
I feel that so much, and, I think that's why all of these conversations. And one of the things that this entire podcast started was I wanted to have the hard conversations that nobody else was having, that we have behind closed doors, that we whisper to each other, whether it's sitting here talking about your bowel movements that are just, like light taboo because, don't talk about poop at the dinner table. Well, you know what? That's actually really important to my well-being. So that's the conversation that we're having, right? And then you're in other situations where I'm like, I want to have these things. It's hard to hear. This is really hard to hear. It's hard to watch, it's hard to hear, it's hard to do, it's hard to say, it's hard to accept, but it needs to be said. Because if we keep saying it, if we keep talking about it, if we keep focusing on it, then it's not going to be so damn quiet anymore. And maybe eventually, just like what Complicated is showing, is that it's not just a one off situation that this happens to. It's not just one to two people or maybe the random things. This is becoming an actual problem. It's been an actual problem, but we need to see it for what it is and see it as this problem and acknowledge it and tell people this is a problem. Now that we've addressed it, thank you for listening. Let's all get together and talk about how to fix it and stop making patients apologizing for things that aren't their damn fault.
Well said. Well said. 100%, 100%. And I think that's the hope, right? Like, that's
Mhm.
why, I think the message to anyone out there that's living this life, first of all, you're not alone. It's okay to retreat from care sometimes if you need a break and then get back to advocating for yourself. But, we can advocate, we can navigate safely. You know, we can make this better. We can help better support doctors. All these things are achievable, but you have to be able to admit it's a problem first. And I think that's
Yeah.
the goal. You can't fix a problem if no one acknowledges it exists. So
Yeah.
hopefully the film is going to help people in positions of power to understand this really is a problem we need to look at. And hopefully through support groups like G-PACT, through what I'm doing with Elevate Rare and TCAP and all the other things,
Yep.
hopefully the people that are living this life can also have a voice at the table, to
Yeah.
talk about how to fix these problems because we live it and we know it.
Yeah. And it's funny because I got quiet, like talking about like retreating a little bit, like in my own personal advocacy, like what I do it for my day job and what I do here, like that didn't get quiet. But like me personally, I stopped talking about like my own struggles and my own issues and telling people I'm like, I had surgery, like, but I don't really talk about it, right? Like I don't put it out there anymore because for me it was a combination of things of like I just I needed to, like, dissociate from it, and the more that I talked about it, the more it was real, and the medical trauma that I've experienced, that we've all experienced at one level or another, and the medical trauma that my husband has experienced with me in the last couple years. Like, I've been septic since 3 times since we've been married, and it has been some of the worst experiences that I've had, and scaring the hell out of him of not knowing, what was gonna happen? Where do we turn? Are they going to believe me? Like, it gets to a point where you don't even wanna call for help because you're so afraid that someone's not gonna believe you. Or if you go in and you say, "Hi, like, I have EDS, like, I have MCAS, I have POTS, I have gastroparesis, I have the, like, trifecta plus every other comorbidity," and it's like, "Do you, or are you just trendy?" Like, that
We've
that
we've
one.
we've been hearing that now, and I have to tell you, they're like, "Oh, it's an internet diagnosis," and it's like, I laugh because 'cause I'm like, "Well, thank God it's getting out there." But the
Right?
the sad part is the reason it's an internet diagnosis is because people are getting such bad care that they're vocal on this on the
Yeah.
social media.
I'm
So
like, why aren't we looking at it as like, hey, again, what we do when we advocate, what Morgan was doing all those years ago, what we're still doing. It's like, even myself, I look at something, I'm like, well, I have like 9 out of 10 of those issues. I'm not going to self diagnose, but I'm not going to ignore that either. So you might bring it up to somebody and you're like, hey, like I'm starting to kind of notice some of these things that I've brought up. If you go back in my records and see, we've been talking about all these issues for the last like 10 years, but now it looks like there might be a name for it. It's like, oh no, that's trendy right now, or that's just what they're like. It's and that in itself, it's like the fear of moms bringing their kids to the hospitals and advocating for their kids in fear that their kids might be taken away because they think that they're abusing them, to women who are afraid to bring up anything because they might get gaslit and just told to lose some weight, or that they're afraid to go to the hospital because you have a rare disease and you know that a specific medication, whether it's pain meds or something as simple as electrolytes, are the thing that you need, and you advocate for yourself and they don't listen to you and then they put non-compliance in your chart. All of these things make people want to stay home and they die isolated in their home and they suffer in their homes. We'll never be able to fix it completely, but this is why we need to say these things, because maybe out there, and I've been very, very privileged to see some of these physicians change and see new, younger physicians coming into the space now, acknowledging pain patients and acknowledging chronic illness, and not just saying, like, I believe your disease, but I believe all the things that you go through in your disease. I believe that this is affecting you here. I hear you when you talk to me. I hear you and I want to help you. And it's like, you can't necessarily teach empathy, but you can show people empathy. You can teach people how to communicate effectively. And maybe, just maybe, if in the first interaction, the patient doesn't feel questioned, both ways. The physician gets better information from the patient feels validated in their experience, and maybe you actually find a way to care for that patient and give them a little bit of a better life. Because I guarantee you that none of us want to be here. None of us want
No.
to go to the doctors. None of us want to go to the ER. I don't want to, I never want to go. And I've said to my husband, I'm like, if I'm telling you I need to go to the ER, I'm probably dying because I do not want to
Right.
go and I'm
That's the
afraid
last
to
place
go.
anybody wants to go, right, and you know they're
So,
probably not gonna help you because if they do acute stuff and as soon as they hear you're chronic, yeah, it's a mess, and, you know, you're talking about something that I think is another kind of thing that people understand is that whole chronic identity, right?
mhm,
It's another narrative, like, "Oh, she's always talking about her illness, she's always, you know, she wants like, she's enjoying being a patient," and that couldn't be further from the truth, and it's like
yeah,
people talk more about their health care when they're not getting what they need.
mhm,
And, you know, my kind of, you know, mic drop moment is like, okay, connective tissue's everywhere in the body. We know all these, you know, GI issues and autonomic nervous and all these issues. They're all connected. Why isn't risk management in these hospitals being like, learn about it?
yeah,
Because how many adverse events are preventable if they just take the time to learn about connective tissue disease? Like, let's be honest, right? And
yeah,
we have another problem though that I think is something that's going to be really interesting to see how it teases out, because unfortunately, you know, again, not no one's ill intended here, but research is moving, and as we're
mhm,
understanding things that weren't, it's like Crohn's disease, right?
mhm,
There was a lot they didn't understand about Crohn's disease, and now it's a validated medical condition. And I truly think that we're on the cusp of that, hopefully, with
absolutely,
a lot of these conditions. But because of that, you know, there has been such a history of misdiagnosis, and you have physicians who have published papers that are now wrong. Do you think
yeah,
those senior level people in those hospitals are it's going to be easy to acknowledge that? No, it's not. Of course it's not. You built your whole career on a premise that's wrong. You know, what does that look like now in these clinical settings? And I don't know the answer to that. I'm just throwing out the question because I've run
yeah,
into it. I've run
yeah,
into it talking to a physician who, you know, really got it wrong. And how do they, you know, obviously what we want as patients is to acknowledge the historical, you know, mistreatment and just maybe the understanding that when we come in as patients, we're not anxious, we're traumatized, and we're not being difficult. We're just trying to avoid being harmed.
yeah.
And I think, you know, if physicians can kind of understand that when people with complex conditions come in the door, I do think it would make for a you know, a smoother road.
Yeah, absolutely. I couldn't agree with you more. And I've been in situations where I'm sitting here like I am just done. I'm done fighting for myself. I don't care. Like just do what you're going to do cuz you're not going to listen to me anyway. Cuz it's so exhausting to sit there and be like I don't want to do this. There was a couple hospitalizations ago for me. They put me through so much unnecessary testing. And I'm like part of me was like, you know what? Maybe they'll find something that'll answer a question that I've had for a long time that I never had the answer to. And I'm like, I don't think this is the problem, guys, but pop off. Like, all right,
Right. Right.
whatever. And then they come back, yeah, that was negative. No,
Well, and so here's the other
really?
question. So why aren't the CFOs wanting to learn about this? Like
So I'm like, I could have saved you a
like
lot of
think of the
money.
money being wasted. Why don't the insurance companies care to know about this? And I'll tell you, like, this is a really horrible story, but like in my neighborhood, I had the medical director of a very big insurance company, the medical director in my neighborhood, and he saw what was happening to my family. And of course, he kind of stepped away because I'm at the best hospital and nothing's getting better. We're getting worse and
Hmm.
worse. So finally, I went up to him and I said, "Hey, want to go for coffee? Like, I can tell you right now how much money is being wasted with the same
No.
test over and over again and this and that." And he's like,
Hmm.
"All right, yeah, I'll call you." He never called.
Yeah.
And I understand, you know, he doesn't want to get involved. That's fine. But like, I agree with you. Like, the money wasted is huge. And again, I don't understand. There's so many
Yeah.
things I don't understand, but I'm trying.
Yeah. That's like I think we could sit here and talk till next week if we went down that road because we wouldn't find an answer. We would just find a
No.
bunch of things that we found that were wrong. But it's again, it's situations, these conversations like we need to just continue having them. And I understand why people it's like I don't want to talk about that, it's embarrassing, or I don't want to talk about that, there could be repercussions, or I don't want to say something and it's like, well, if you say something and you're like, "Hey, I have this issue and I'd like to talk about it." Like, people do understand intent. Most people do understand intent. And if you're just like, "Hey, I went through this experience. I'm not blaming this person. I'm not pushing, into one corner over here to make sides." It's like, "I just want you to know that this happened and it also could happen to you if you're unlucky enough to ever be in that situation too." And we want to protect our friends. We want to protect our family. We want to just protect other humans. And nobody wants to be in those situations. Nobody wants to be hurt. No patient wants to be here. And, you know, especially with all of the complexity in every patient story that you guys highlighted and complicated, those are the things that need to be seen and they need to be heard no matter how hard it is to watch, no matter if you have to take a break in the middle of it and come back to it, if it maybe feels like it's a little bit too close to home for you, but those are the important moments. And we're I because I speak for myself, but others too, that we're grateful that there are people like you that exist who are like, we need to talk about this. I'm identifying this, and I'm not just identifying it and walking away. I'm identifying this issue and I want to amplify it because this isn't fair. This is hurtful. This is harmful. And we want to bring awareness to it because that's the first step in advocacy, right? Is just awareness. And if we
Right.
talk about that and then you get more people like what you were talking about in the very beginning, like you were alone in this and then suddenly you weren't. So we don't want people to be alone. We want to advocate. We want to bring awareness to this. And that's why, for me and for G-PACT and for our piece of this, why I wanted to make sure that we talked about this before the film came out, because I think that there's a lot of people in our community that would benefit from feeling something from it, that maybe they would just feel less alone, feel like this is something that I want to share with my family because this is something that I
Yeah.
went through, whether they watch it themselves or to say, like, wow, I didn't know that. I thought it was just me, but it's not, and then it
Yeah.
opens up more conversation, and the more people that know that this exists, the more conversations are had and more awareness is spread. And we're just really grateful to everything that you've done and chatting with me today and, just really and everything I know that you're continuing to do because you don't let off that gas pedal either. So I know. I
I
know.
can't. I can't. But I want to, yeah, again, I wanted to just thank you so much. I hope people can use this film as a tool. So
Yeah,
many people within their own families aren't even believed, or people don't understand their life. And hopefully, this film will just help promote awareness, and support, and give us an avenue, a tool to make change. And that's kind of what I'm
absolutely.
focusing on now for my next chapter. So yeah. So thank you so
Absolutely.
much for having us on. And
Yeah.
yeah, let's see what the year brings. Right, the film comes
Yeah.
out, and let's make some noise.
Yes, we will. That's why I said my goal is that we get all of us collectively so loud that you just can't ignore us anymore. You can't. You have to just deal with us.
That
So,
would be good. That would be
thank
great.
thanks, Donna.
All right. Thank you so much.